My name is Bella. I'm an assistant professor at the University of Haifa, and I'm very, very excited to start this pitch competition of MICCAI 2025. Actually, this is not the first pitch competition, and we will soon talk a little bit about that. But in any case, what is the Startup Village? The idea is just to highlight startups that are close to the core topics of MICCAI, and actually just to go from the research to the market with products. So this is the general idea of this Startup Village. Before I will explain exactly what we'll have in this particular competition, I would like to invite Marius to say a few words, the president of MICCAI, to say a few words about MICCAI in general, and also the previous startup pitch competitions.
Thank you very much, Bella. Well, good morning from Washington, D.C., and whatever time zone you are. And yes, welcome to the Startup Village. First, I would like to start by congratulating Bella and Nicola for organizing this fantastic event, and something that has been very dear to me, and I'm glad to see back at MICCAI. About MICCAI, I think I can only say a couple of words. I'm assuming everyone here online is familiar with the society, right? The Medical Image Computing and Computer-Assisted Intervention Society. And we are a leading forum for research, education, and practice in the fields of medical image computing and computer-assisted interventions, robotics, and with a big portion on machine learning in medical imaging. That's without surprise. But MICCAI also has been very vested in promoting exchanges and collaborations beyond the academic field in every level that touches science, from ideation to commercialization, as we've seen today at the Startup Village. And it's great to have today Leo Joskovic also with us, because he remembers well when the Startup Village ignited online at MICCAI 2020 in Lima in Peru, when he was general chair. So good to see you back, Leo, here in a different role. And Nicola has been a part of this from the very, very beginning. So we have a little bit of a history. And the reason of bringing the Startup Village to MICCAI, I think it's quite obvious. We have very strong ties with the industry at MICCAI, and we appreciate the support that we get from commercial entities that are helping not only our educational initiatives at the society, but also the career development of our scientists. And again, to paraphrase Bella here, I think it's very important to translate what comes, the best ideas that come out of MICCAI, into products that are available to the broader community and to the broader society, because without putting good ideas into products, they remain on a paper, even if it's a very good MICCAI paper. So congratulations to all the finalists that are at the Startup Village. And Bella, I'm passing the microphone back to you.
Thank you very much, Marius. So now we'll explain a little bit about this particular pitch competition, which is slightly different from the previous ones. So first, all the startups that are here, you will already have, you'll also already have some benefits. So of course, in terms of the social media of MICCAI, the newsletter and the social channels, your startups will be posted whenever we can. And also you will have a direct connection to NVIDIA Inception program and AWS Startup program, which I think is very exciting. So already all the participants here in the pitch competition will have that. And then, of course, we have a lot of perks to the winners. So we have for the top 3 startups, they will have a dedicated space at MICCAI 2025 exhibition area. They will also be networking partners at the MSB networking event, which is a very nice event organized by the MICCAI student board. And also the top 3 startups will get a free registration for MICCAI 2025 and the society membership. So this is all of this is for the top 3 startups. And the first place will, in addition to that, also get $1,000 MICCAI Travel Award, which is of course even much more. So so a lot of things that you can benefit. Here you can see all the startups that are participating in this event. We have 9 startups, 9 amazing startups that were selected. And the way we will do this competition is in batches of 3, so that it will be easier to remember all the startups. So that means that we'll have 3 startups in each batch, followed by a Q&A session where the judges will ask their questions for the 3 startups. And then, of course, another batch and another batch. And at the end of this, you will do the voting and of course, also the judges. So regarding the voting, so the nice thing about it is that all the participants here in the webinar will have the opportunity to vote for their top 5 startups. And this, I will start the poll at the end, after all the startups will have their pitches. And so all the people from the audience will be able to vote as well. The way to vote, maybe I'll say in advance what you need to keep in mind for each startup before we start with the pitches. So please think about the impact and the innovation of the technology, the quality of the presentation, and the relevance to MICCAI. So this is kind of the general criteria. This will be also the criteria after we will select in this virtual pitch competition the top 5 startups. This will be also the criteria for the judges after that to rank the top 5 startups and make the final decisions. Okay, so please try to keep in mind those things when you hear each one of the startups. And today, what we'll have today, so the audience will vote and the judges will vote separately. And actually, we will then combine both of the results, and we'll have 50, the final score will be 50% by the judges and 50% by the audience. And this is how we'll do the voting. Just before we start with the pitches, here is here a little bit show and explain about our jury members. So we have Marius, who already spoke, of course, the MICCAI Society president, but also a professor and chair of research and innovation at Children's National Hospital. We have Nicola, who is also co-organizing this event, and she's a senior manager solution architecture, EMEA, and head of healthcare and life science at NVIDIA. And she's also a MICCAI Society board member. We have Alex Lem from AWS. He's a tech business development, medical image innovation at Amazon. And we have Bia. She's the assistant director of medical computing from Kitware. So we have 3 members from the industry, and we have Marius, the MICCAI president, and those are the judges, and of course myself. I'm the moderator of this event. So without a further ado, we will start with the first batch of startups. And please, Leo, go ahead with the presentation.
Okay, before I start, I ask you for remote control. And
you should have it. Please check.
okay. Okay, so we can start. So hello, everybody. My name is Leo Joskovic. I am the co-founder and CTO of HIRAD, which is a company for empowering oncological care. Oops, sorry. How do I go back? Previous. Okay, this is difficult. I'm sorry. Okay.
You want me to go?
Oh,
Okay.
okay, sorry. Okay, so let's start with the need. The need is radiological longitudinal analysis of CT and MRI scans for oncology patients. The situation is as follows. You have a patient that is originally diagnosed with cancer, and as you see in the left side, you see the original scan that shows where the tumors are in the liver. Sometime later, there is a new scan taken, and the important thing is to know not only what is the tumor burden, so detecting, of course, the lesions, but also knowing which lesions are existing and which ones are new or maybe disappeared. As the treatment starts, this makes changes. So, for example, here, the current scan, you have no new lesions, so the only change is in terms of the tumor burden. This is a very time-consuming and a very different task than doing the original diagnosis. And we have developed a solution for this. Can you, the next slide? Okay. So the challenge is that about 50% are this type of scans, and that leads to errors. There are standards to do these measurements, but they are very time-consuming, and this is according to the RESIST one. Okay, so the solution is a fully automatic end-to-end AI-based pipeline that takes the relevant scan, detects the lesions, detects the lesion changes, and produces a quantitative report. It has a novel deep learning component called SimuNet and a novel longitudinal multi-organ analysis, which is based on rules. It's a combination of a rule-based and deep learning approach, which has been published both in MICCAI and presented in MICCAI and related conferences. And it basically automates this task. This is the report that comes out, a quantitative report per organ. So we have currently the liver, the lungs, and the brain with and without contrast agent. This is the report that the radiologist gets. There is a user interface that allows the user to see where the relevant findings are. Each one of the points is one time point. And you see here the explainability of the report, which basically shows the clinician where the finding is, where the changes occurred, and how they happen. What is the benefit of this product? It takes 3 times faster assessment because, as we said, radiologists have to look at a number of scans, about 70% shorter measurement times, and of course, a financial benefit that results from that. The accomplishments is that the liver part, so we have multi-organ and multi-modality. The liver part has been cleared by the FDA a year ago and is already part of the product. We have a 510(k) submission for the lung and the brains. And this is based on an oncology platform, which is ready for installation. Because we do oncology, we also do lymph nodes and extend this to PET imaging as well. Currently, we have installations here in Israel in 2 hospitals and 2 hospitals in the US. And this is based on about 10 to 12 papers that most of them is technology developed by me and my students and presented at the MICCAI conference. It requires registration, deep learning, and the different topics that are. This is the roadmap for the product. We are doing currently anatomical imaging, but we plan to move on to functional imaging. We already can do PET-CT with the same principle and the same pipeline. Here are the members of the team. Professor Sosna is the chairman of the radiology department, and Yossi Suret is an entrepreneur and the board. Thank you for your attention.
Okay, thank you very much, Leo. And now we will move to HIST AI. So either you want to request access?
Yeah, I have already requested. Yeah, thank you very much. My name is Alex. I'm CEO and founder of HIST AI, and basically we are focused on computational pathology and AI development. Please, next slide.
Okay.
Yeah, so pathology, unlike other medical imaging domain, significantly lags behind other fields, and it mostly because pathology is mainly analog, so the adoption of digital pathology is very slow. And because of it, you have to invest heavily in hardware and software. There is no reimbursement, unlike radiology, for example, or system-wide healthcare investment in, like, for example, other markets. And this makes the return on investment in digital pathology basically questionable. And probably the AI is the only thing that can make this return on investment positive. But unlike other domains, the pathology AI is still very slow, and because you have to have proprietary data set that is very expensive, and due to low digitization, they're quite rare. You have to spend a lot of financial resources on data annotation because you have to acquire annotations from expert pathologists. There's a lack of publicly available resources with data sets, and this leads to a situation where companies developing AI models that have been trained on just a small portion of data sets. Sometimes it's just like a couple of hundreds of images. Next slide, please. And what we are trying to address, we want to accelerate the adoption, accelerate the AI development, and we decided to open source a significant portion of our proprietary data set to the community, and we have open sourced more than 100,000 of whole slide images out of 50K, almost 50K cases, unique cases, and this data set is quite unique because it comes with IHC stain slides with significant portion of it, so more than 17K, and it provides like different stains and clones. And it also comes with the very detailed descriptions. Yeah, it's okay to be on the next slide, because we provide the fully digitized digital reports with 10 fields, and we provide grossing, we provide micro descriptions, diagnosis, incoming diagnosis from clinicians, and sometimes it even comes with some molecular data. Yeah, next slide. Another large initiative that we have is a SPIDER initiative. This is a data set. This is a fully supervised data set of pathology images with baseline models. This is a multi-class, multi-organ pathology data set, and we have already open sourced more than 5 million of fully annotated patches. So we have a core and a context patches, and currently we have 4 organs, and we plan to open source and to label and open source 16 more. So it's going to be like around 50 million of pathology patches. And currently we have 69 morphologists across 4 different organs, and we provide access to full multi-class models. And compared to other data sets, current SPIDER data set is larger than all the other patch level data set released combined. Next slide. Yeah, this SPIDER initiative allows to train machines to see the picture, to see the slides in a very similar to pathologist way. So it allows to understand every single patch on the slide, not just with some region of interest, for example, oncology, tumors, or microenvironment, but it allows you to understand the full picture, and it allows researchers to build, next slide, please, different applications and next-gen AI foundation models, for example, because it allows to, in combinations with other types of models, for example, like cell segmentation and cell classification model that is currently also available on a Hugging Face page. Yeah, you can build the very large.
You have 20 seconds. Sorry about that.
Yeah, and this is just like our next steps, but we want to use the SPIDER initiative and his data set in order to label the largest image text pairs data set, and most likely we will open source it too. Thank you very much.
Thank you. The next startup is Silytic.
Yeah. Can I ask your help to control the slides?
Yeah, sure.
Okay, fantastic. So the goal today was to introduce you to Silytics. We're fundamentally a company that builds AI-powered medical devices to measure and to reduce surgical risk. We're driven by this fact that when it comes to safety, surgery is really an industry that is stuck in the past. Almost every other high-risk industry, from aviation to automotives, has systematic safeguards in place. Meanwhile, surgery causes more preventable deaths than any of them. And here you have ISO standards for your toothbrush and for the milk you drink in the morning, but not for surgery. Next slide, please. Historically, the operating room has been this black box, extremely high stakes, but very little data coming out. The only documentation was handwritten reports, often unreliable and often unstructured. Even well-known guidelines are inconsistently followed. And fortunately, a lot of that is changing now. Video guided procedures are making performance transparent. So now we can see exactly what's happened, and it's harder to ignore that guidelines and best practices aren't followed. And surgical societies are already acting on this. In Japan, surgical credentialing is based on video review. And we're now starting to see some of that same shifts happen in the US and in the EU. And as all these incentives begin to align and hospitals start collecting these massive volumes of surgical video, AI is the only viable way to actually analyze all of this. Next slide, please. It's where we come in. So we offer two platforms that work together. Assist, which is this collection of AI-powered assistants that help surgical teams follow guidelines and avoid complications with real-time support. And then Highlights, which is a post-operative platform that will essentially collect all of your videos and then help teams track their intraoperative performance. Together, they close the loop between execution and feedback. So really enabling this system where surgeons can learn and improve from every procedure. Next slide, please. I want to be extremely specific on our first use case, which is to prevent bile duct injuries in cholecystectomy. So this is a procedure that's done for a benign condition, often in young and otherwise healthy patients. But if something goes wrong, their life can change rapidly. So a threefold increase in mortality, lifelong treatments ahead of them. Even for the surgeons, it's a leading cause of surgical litigation and burnout. In the US, it ends up costing over $1 billion a year annually. So and the worst part about all of this is we know how to prevent it. There is a guideline, a surgical technique called the critical view of safety that prevents 97% of these complications. Yet it's done in 15 to 20% of cases. So we're showing that with Highlights, you can detect and track that gap in implementation with AI. And then Assist can provide real-time support to actually increase the implementation of that safety step by 3 to 5-fold. Next slide, please. I think what makes this story special is that both our research and commercial journeys really began at MICCAI. So on the research side, the founding team was entirely trained under Nicola, who was a MICCAI fellow, and the core technical building blocks of both Assist and Highlights were developed through years of MICCAI work. But we realized that early on that building impactful surgical AI wasn't just a technical problem, so it's also a clinical one. So our co-founders then created Clinica, so which is this dedicated clinical day at MICCAI to make sure that the problems we solve are the ones that really are affecting real-world clinical care. And to take that even further, we led the SAGES CVS Challenge. So this is the first competition led by a surgical society at MICCAI. We worked with hundreds of clinicians and 50 hospitals globally to build this data set of 1,000 cases. So here the goal was really to get the community working on these messy problems that show up on real-world data. Parallel to all of that, we've been pushing this commercial track. So starting with this first live AI augmented procedure that we did, we conducted this in partnership with NVIDIA and streamed it to an audience of 70,000 surgeons worldwide. Since then, we've launched clinical trials, validated our regulatory path, and are preparing to deliver what we believe could be the first FDA-approved real-time AI medical device that improves surgical outcomes. Now at MICCAI 25, I think these two tracks are beginning to converge. We're co-leading the Lighthouse Challenge, so on AI-based risk assessment in cholecystectomy. And at the same time, we're on track to deliver the first medical device tackling the exact same problem. So here we look at the Startup Village as potentially a really ideal stage for us to show what is possible when research and commercial evolve side by side, each accelerating and grounding the other. Next slide, please. I think I can stop there.
You have 10 seconds, just finish it up.
I'll stop there. Thanks for your time.
Okay. Okay. So we will now move to the Q&A about HIRAD, HIST AI, and Cylytics. So first, is there any question from the jury?
Yes, maybe let me kick it off. So thanks a lot for the presentations. It's really great to see that so many MICCAI research made it to products, so very different fields. I have a question to Leo, because at some point you mentioned it's a fully end-to-end automatic AI-based pipeline. And I saw several research papers contributing to that. How much is it like automatic really the input and then you get the output, and how much influence does the user have in between, or how much insight does it really have in terms of how the AI came to the result?
Okay, so the way to think about this is like a spreadsheet. So it's fully automatic. It's a pipeline which analyzes the individual CTs. Each organ does a segmentation, then registers the scans with the deformable method, then does the detection, and then classifies the changes. So it's an entire pipeline. It produces the results, but the results are like the results of a spreadsheet. So if you click on the image, let's say the liver, you want to see what was the reference, the lesion, you click on that and the system brings you automatically to the slice where a clinician can see the segmentation and the matching. So it's like in a spreadsheet, you compute everything and then you click on a cell and see what happens. If there is an error, for example, a false positive or a false negative or a mismatched lesion, then they can click on it and everything gets recomputed. So the report gets recomputed. So explainable in the sense that we show the results, and if for some reason it's incorrect, they can fix it in an Excel style fashion.
All right, thanks a lot for the clarification. Handing over to
Marius.
I have my hand up there, and again, thank you for the great presentation. This is very exciting to see this work coming out of MICCAI and going into the commercial space. I have questions for everyone, but since Nicola already asked a question to Leo, I'm going to move to Alex and take the next thing. And then I see hands coming up from the other judges. So I think there are plenty of questions ahead. So Alex, two quick questions. First, if you could elaborate more on your business model and your market strategy and how you're going to use the data that you have here. And secondly, I could not, stop myself from asking, with this data set that you have, are you participating in any of the MICCAI challenges?
Yeah, thank you for the question. Yeah, currently we have our own proprietary platform called Cylytics. This is a pathology viewer with the opportunity to run our proprietary AI models. And we can like analyze slides, label things, and yeah, to manage the case management and so on. And we also have like third-party integrations, and currently we're integrating with one of the largest digital pathology platforms in the world. And yeah, so we're not participating actively in challenges at the moment. Yeah, because we're quite a small team, and yeah, we're just fully focused on our projects at the moment. But yeah, somewhere in the future, we consider this opportunity as well.
Thank you. And I'll pass on to Bea.
Thank you.
So in the same fashion, I'm going to move to, I also have questions for everyone, but I'll move to my questions to Cylytics. So I thought it was a really nice product proposition. I understand that I need clarification on, because it sounds like it has been mentioned during the presentation that it's FDA cleared or almost FDA cleared, so it's gonna be used as a medical device. But also it seems like it is very well aligned with a training tool. So I wanted to ask for the ideas of the presenter on whether or not this is going to be like the people from Cylytics is going to be seeking accreditation to perhaps integrate with residency or fellowship programs in surgery. So kind of like rounding that, clear a little bit more how this is a medical device, because I don't think that was I understood that very well from your presentation, and also some thoughts on is accreditation potential for in cases also a training tool.
Yeah. So thanks a lot for the question. There are a few different elements. I'll try to address them separately. First, with the medical device, I'll be extremely clear. We're just about spinning off right now, so we haven't cleared any medical devices yet. What we've done so far is we've spoken to the FDA through a process called the pre-submission meeting, just to clarify what the regulatory route would look like. The meeting went, I think, better than we could have expected, because we clarified quite a simplified route with not requiring a prospective trial to get it approved, despite it being de novo. Just to give you some rationale on why we do this in the first place. Right now, I think in surgical AI, we're in this phase where there's really a lot of hype, but there aren't actually any cleared devices yet. Meaning there aren't any devices that are marketed for a specific clinical intended use yet. And we really think it's time for someone to show that clinical endpoints can start to be affected. So here we view kind of our wedge in all of this as adherence to guidelines, because this is something I think is quite underrepresented in the field. We know there are a lot of things that there's already a mountain of consensus on, that every society agrees on, that is not done in practice. It was the rationale behind some of the largest quality improvement initiatives we've seen in surgery in the last decade. So like the surgical checklist, which is just making sure people communicate well before the procedure that they've introduced themselves. These are small things, but doing them systematically, like really just conceptually, is something that's going to improve outcomes. It's the same thing that's done in aviation and all these industries, where a pilot doesn't go through a checklist because he doesn't know how to fly the plane. It's because doing it systematically is naturally going to improve outcomes. And in all of this, accreditation fits in nicely, because here this is also what these same bodies, the Joint Commission, SAGES, the American and European societies do. They work on building guidelines based on available literature to offer what these best practices could look like. The problem in surgery is there's not a lot of accountability today, because the most of the information we get out is just those handwritten reports, which don't actually give a lot of information on auditing and things. I mean, things that we accept are a necessary part of everything else, including the toothbrush and the razor you use, but not for surgery for some reason yet.
Well, I mean, kind of like just quickly, and I'll pass it on to Alex. I think because some of the surgical techniques right now are acquiring data, such as laparoscopic surgery, you show a video in your presentation that, all of that data is collected and could be kind of like your inroad into other more complex surgical procedures.
Absolutely.
Yeah, thank you for the answer. Yeah.
I actually also had written down a question for you, Deepak. So therefore, I'd like to continue with you just 2 minutes. So diplomatically speaking, surgeons are a little bit hesitant when it comes to AI-based support during the surgery, right, for their procedures. So in general, I'm aware of other platforms like yours, more on the educational front, like theater, for instance. But again, this is purely for education purposes. When you introduced your idea and your platform to surgeons, and because you also showed that you already tested it, how did you overcome those the resistance you were facing? Because of course you are now providing actually a surgery QA platform, which is kind of new, right? Looking over my shoulders as a surgeon.
Yeah, no, absolutely. I think it's a problem in medicine in general that there is resistance to large changes, and rightfully so, I think, also in a lot of cases. Just conceptually, a lot of the positioning that we've taken is to minimize changes in the workflow. So even when we speak about that first device that I described, the first solution, we're basically increasing the implementation of something there's already universal consensus on. This has not even come from us as a company. This is what's come from the guidelines, from the societies that are actually, I mean, they're all consisting of surgeons really trying to disseminate what should be done. there's almost universal consensus on the first indication we target. It's the same from the societies in the US, EU, Asia. So this is one thing that already goes a long way, and we're not introducing a radically new technology that tells you you need to do this thing a completely different way, so in fact, our first application is something as simple as offering reminders at the right moment when detected by an AI algorithm. It's the same concept as the checklist, the preoperative checklist, but so all these other parts of surgery that they've managed to optimize, the preoperative, postoperative, but you can optimize those things because they're static. Uh, Intraoperatively, very differently, it entirely depends on the context of the procedure. If something has gone wrong, if you're noticing that there's a series of small events happening. So you need a system that starts to understand this context and offer kind of guidance based on that context. Just to go back to your point, so that I mean the few things we're doing. One, there's definitely we're trying to minimize the kinds of recommendation we give to align with existing workflows. The actual physical embodiment and the connection and integration also we're trying to minimize disruptions to the workflow. So basically a plug and play hardware that connects to any existing system that's already in the operating room. It'll connect to the existing monitor, so you're not adding an additional device that people have to look at. I mean, it's a series of these small things that minimize how much is going to change and increase the acceptability. Even before we go to full-blown guidance, we're trying to offer simpler, lower levels of assistance, which is reminders for something that's already known. So, I mean, I think this gradual stage is a lot of positioning on how we tackle this.
Okay, I think we will stop here, Maris. I see that you also want to ask something, but what I suggest is I see there are also questions in the webinar chat and in the Q&A. So if you have more questions, please ask there the panelists, and we will continue to the next batch. Okay, so next we'll have Gray Matter Solutions, Synthise and Immunova. So please, Gray Matter Solution speaker.
Hi. Yep. Can I get control?
You should you should just try to ask for control. If you can click on my image in the right. If not, we will just need to move on, and
Okay. I'll just ask you to change the slide.
Okay, no problem.
Okay, let's start. So my name is Adnan. I'm from Nanyang Technological University, Singapore, and our company is focused on early detection and enabling early detection of mild cognitive impairment, as well as enabling differential diagnosis and then intervention. So basically, a lot of factors lead to cognitive decline and cognitive impairment, which then leads to brain changes and eventually dementia. We don't want people to get dementia, of course, and that is why we need to intervene in the early stages of cognitive decline, which is called mild cognitive impairment. But the good thing is we have some interventions already. Next slide. So recently, the FDA has approved 2 new disease-modifying therapies for Alzheimer's disease. There are also many studies showing that lifestyle interventions, vascular risk factor control could actually slow down or prevent the cognitive decline over time. However, we need to detect people at the right time and detect them early. Next slide. And that is where the challenge is. The symptoms at the early stages of cognitive impairment are quite subtle and quite varied. So with vascular cognitive impairment, which is a specific type, and then with Alzheimer's, you have different early symptoms. You won't have memory loss. Patients don't report a lot of cognitive changes at that stage. And then a lot of cases go undetected. Next slide. So we have tools to detect dementia, but of course, they're expensive and invasive, and they can't be applied to a large population. The problem is that at the early stage, you have mild symptoms, then you don't do these tests, and then it's too late. So how do we capture people at a large scale and then trigger them to do these gold standard tests? And that's where our first solution comes in. Next slide. So our first product is Recognize. It's a cognitive assessment which basically collects different cognitive features. It is a gamified neuropsychological test which collects different cognitive features, and then our algorithm basically helps in detecting mild cognitive impairment as well as differentiating the vascular from the Alzheimer's. Because next slide. So we've done a clinical study where we see that Recognize is almost 90% accurate in detecting mild cognitive impairment, as well as with a specificity and sensitivity of 85%, compared to the ground truth, which is an interview plus a brain MRI. But how are we able to do this? Next slide. It's because we've collected data from more than 1,000 subjects at the Dementia Research Center in Singapore, and we've created an algorithm that looks at the brain changes as well as the cognitive changes and differentiates vascular from Alzheimer's type. And this is what we've already filed for PCT filing last year, and this paper is also under review currently. Next slide. So we're not just stopping at early detection, but we are creating a platform which does early detection as well as management of cognitive impairment. So incorporating other biomarkers as well as incorporating clinical information to give a personalized management plan to patients. Because for people with mild cognitive impairment, you don't necessarily need disease-modifying therapy, but a lot of at-home interventions can actually improve their clinical outcomes. Next. So our team consists of people from a technical and a product background, as well as neurologists and professors of neuroscience. And we have advisors from the medtech space from various countries. Next slide. Of course, there's a large market. A lot of people are at a risk of developing MCI, especially with increasing lifestyle factors like high blood pressure, cholesterol, diabetes. Our initial target market is Singapore and Southeast Asia, after which we're looking to expand either to the EU or to the US. Next slide.
I had none, 20 seconds.
Yeah, so we've not just stopped at developing the product. Actually, it's listed as a medical device in with the Singapore regulatory body, and we've already started commercializing. Quite a few GPs in Singapore are using it for early screening and health screening, and we want to grow this further. Next slide.
Okay.
Next.
Okay.
Yeah, so yeah, the next slide would be the last one.
So just wrap it up.
Yeah.
And
Yeah, so we're basically looking for partners to grow this further, to enter new markets, and to do more studies. Thank you.
okay, thank you very much. And now we will move to Synthesize. Please.
I just requested also remote access.
Yes, I see that.
Just check if I can.
Yes,
just
right. Is it working?
Yeah.
Perfect.
Working. Thank you. So hello, everyone. I'm Michael, and it's a pleasure to present our startup Synthesize. We are focused on digital twin-based training and multimodal synthetic data generation. Synthesize is a spin-off from the Chair for Computer-Aided Medical Procedures at the Technical University of Munich. So the core problem that Synthesize addresses is that in ophthalmology, the patient volume surpasses the care capacity. And this means that in the past 20 years, we could already see an increase in the number of surgical interventions by up to 90%. However, only an increase in the overall care capacity by 2%. And what's making this even more complicated is that after years of training, almost half of the trainees are not satisfied with their own surgical skills. And on the other hand, we can see that bringing new devices into operating rooms creates many challenges for efficient integration and acceptance of those devices by surgeons. So one way to improve this situation would be to improve the integration of new devices in the training of surgeons. And we do this by creating a digital twin simulation environment from standard diagnostic imaging. And this simulation environment is interactive because we can simulate tool-tissue interactions, but we can also generate multimodal synthetic data such as microscope imaging and intraoperative optical coherence tomography. But how can this actually now improve the clinical systems and outcomes? On one hand, we can combine our simulation environment with a training system that would allow surgeons to train and track their performance and get to a more advanced skill level at the time that they perform the first surgery on a patient. Now, in terms of MICCAI, this would cover the CAI aspect. But then we can also cover the MIC aspect by creating patient-specific synthetic multimodal data. And this data can then be used to train AI systems that are then going to be integrated into a medical device. Now, by exactly the combination of these two paths, we can bring those new devices into virtual prototypes and through our training system, evaluate the impact on the surgeon, but also on the surgical procedures. And this is really the core of our vision, to create a shared perceptual space between computer perception of AI systems and the human perception, because this would allow us to optimize the interaction with new devices and create an improved sense of familiarity and trust that would later lead to improved acceptance of those new devices. So here you can see our training system, which closely replicates a real surgical setup. We have real surgical instruments integrated into a phantom model. Their poses are being tracked in real time, which creates a very realistic interaction with the simulation environment. On the other hand, our training scenarios are very realistic also because they're based on real patient data. And this allows surgeons to especially train for specific complex patient cases. But on the other hand, we can then also bring together intraoperative OCT and microscopy to create multimodal and also temporally consistent synthetic data with full annotations. And this is very helpful when training AI systems to bridge gaps, especially there where access to real data is not available. And finally, we can bring together the training system and the virtual prototyping capabilities and evaluate the impact of new systems. So here, for example, we evaluated different robotic controllers. And in these evaluations, we can measure the task performance, of course, but also the usability of a surgical device. So we can track the learning curve that surgeons experience, but also the cognitive load that a user experiences when performing a surgical task. Various publications have already shown the impact of our system, both to generate data for training, but also an environment to perform user studies in. And finally, through our journey as PhD students and founders of Synthesize, we've always been very closely connected to the MICCAI community. And we are now looking forward to show our technology through Startup Village to this community and expand our collaborations with researchers and companies. And we want to identify new technologies that we can integrate and also expand the use cases of our simulation setup. Thank you very much.
Thank you very much, Michael. So next we have Immunova AI.
Hi everyone, we are Immunova AI, an open source nonprofit startup democratizing access to precision oncology through reliable and sustainable cancer immunotherapy decision optimization.
Immunova, next slide. Immunova was built to solve two major gaps in today's cancer care. While immunotherapy holds promise, current treatment selection is often based on empirical guesswork, and existing AI models are either too computationally intensive, unimodal, or non-transparent. This limits both scalability and trust, especially in resource-limited settings. Our platform aims to change this by combining histopathology, genomics, and clinical records into a lightweight, interpretable, and scalable model. Ultimately, we want to democratize access to ethical and sustainable cancer care worldwide. Next slide.
Immunova's unique selling point lies in its focus on the tumor immune microenvironment rather than the tumor alone. Unlike conventional models that concentrate solely on tumor cells, Immunova integrates spatial, genomic, and immunological data to assess how immune cells interact with and infiltrate the tumor tissue. This distinction is critical as the immune contexture strongly influences treatment response, particularly for immunotherapies. Crucially, this approach enables Immunova to generalize effectively across 36 cancer types, while currently being tested on pancreatic cancer and glioblastoma, rather than being limited to a single indication.
Immunova brings together 5 AI modules that process whole slide images, RNA sequencing data, CMV profiles, and molecular inputs like SMILES to deliver clinically meaningful insights. The immune classification model uses CNN to detect tumor-infiltrating lymphocytes with GradCam heat maps showing the exact locations. We are planning a ResNet 50 to update to boost performance. The treatment response module combines over 1,000 image and omics features to predict immunotherapy outcomes with shape values explaining key drivers. A survival analysis uses deep Cox models on clinical and molecular data to estimate personalized risk, achieving a C index of 0.78. Drug optimization evaluates and ranks up to 10,000 molecules using graph-based models based on predicting IC50. Reversion mapping analyzes 20,000 genes and CNV profiles to model tumor progression through attractive state dynamics, and outputs like DL heat maps, treatment scores, survival curves, and drug rankings all present in an intuitive, clinician-friendly interface. Next slide, please.
Our model is under the MIT license and operates using a nonprofit business model. Firstly, we directly partner with hospitals and research institutions, not as customers, but as core collaborators. They will have unrestricted access to Immunova's range of predictive tools, and in turn contribute to model refinement by sharing anonymized clinical data and feedback. Secondly, non-governmental and non-profit organizations can deploy Immunova in their community health mission at zero cost to allow greater access for under-resourced populations to benefit from our AI technologies without any financial or technical barriers. Next slide.
Our 1.0 prototype's strong results have allowed us to expand to Immunova 2.0, and currently we are developing our 5 modules with a larger and more diverse data stream. Next slide.
Our immune classification model uses AI to detect and classify immune cells in tumor images with GradCam visualizations that show where the activity is happening. Even in early testing with limited data, the model performs strongly with scalable architecture, and advanced models like ResNet 50 are on the way. Next slide, please.
Our model is powered by an experienced core team of 9 people from 7 countries, and we're collaborating with 5 institutions. We were kickstarted with Emergent Ventures, who gave us a $10,000 non-dilutive grant. Next slide, please.
Immunova is working towards our mission to expand equitable access to precision oncology, and our vision is where precision technologies are reliable, sustainable, and accessible to all. To guide this, we're working closely with a UN-affiliated youth network called the Dynamic Teen Coalition to ensure our work remains globally informed and community.
Next slide.
You have 20 seconds.
Now we move on to our projected impact. Our preliminary beta testing at Yale projects a 40% reduction in unnecessary immunotherapies and a 60% decrease in associated treatment costs. We believe that MICCAI will give us a platform to network and further expand our collaboration network. Do visit our website for more information about our platform and the team behind Immunova. Thank you so much for your time.
Okay. Thank you very much. So we'll now move to the Q&A for the 3 startups, Gray Matter Solutions, Synthesize, and Immunova. Do we have a question from the judges? So yeah, I see Bea, you are raising your hand.
Yeah, thank you, everyone. So I have a question for Michael from Synthesize. I had some questions about your. I think the setup is fascinating, and I was interested to see or to have you develop a little more and whether or not you have already done any work to integrate haptic feedback. But then one of your slides said that you were already working with several robotic prototypes, and one of them was a haptic device. And I had curiosity about that aspect of your product.
So we have to differentiate in haptics between the artificial haptics that we can bring in robotics, which might have a big impact on robotic surgery. But before that, I have to talk about the haptics that surgeons experience when doing this retinal surgery, because so it's a minimally invasive surgery, and they enter the instruments through the trocar, and this is indeed the only haptic response that they get. So the retina is so delicate that they don't feel anything. I mean, the forces are way below the human senses. So there's no haptics that surgeons feel. Of course, haptic feedback in robotics has a very different meaning and value. But the training setup as we have it now has this integration with real trocar, so they feel this interaction with the tool and the trocar. And then there's basically no haptic on the retina.
That makes a lot of sense. Thank you.
Okay, Alex?
Thanks. So I have a question for Adnan from Grey Matter Solutions. When I took notes on one of your earlier slides, you had an AUC score above 90%, which was great. But cognitive decline, so in general, can be episodic, right? And when we do a 10 to 15 minutes assessment, how can this account for my day-to-day performance, and how do you deal with this?
Yeah, so according to the diagnostic guidelines in the DSM-5, so there is a variability that's expected on a day-to-day basis, and that's usually supposed to be captured. So we are trying to distinguish diseased from non-diseased. So there will be a larger effect between the two groups that's larger than what is expected on a day-to-day basis, and that's what we are trying to distinguish. What we are comparing it to is basically a 4 to 5 hour neuropsychological assessment, which really looks into the details. But what we can get from a digital assessment is like reaction time, response time, variability. So we just factored all of that in, and then we got a good separation between the two groups. Of course, there will be day-to-day variability between people, but it won't be so much that it puts them in two different groups. That's the key definition of the disease.
Then perhaps one quick follow-up question. The market segment is like already like not crowded, but there are like alternatives available, right? Cogstate or Linus Health.
Sure.
What is like the key differentiator when you take a look at the competition and your company today?
Yeah, so what our IP is around and what our next steps would be is to really guide clinical decisions. Right now, the cognitive screening tools are giving, whether you're likely to have MCI or, but what we want to enable is, okay, what is the next step that you need to do if it's vascular or Alzheimer's? And that kind of differential diagnosis enables you to have a better next step. So if it's vascular, then you should do an MRI. Whereas if it's Alzheimer's or more likely to be Alzheimer's, then you should do a biomarker test for amyloid or a plasma tau test. And currently, there's no other tool that is looking at doing that differential diagnosis and building that pipeline. Because traditionally, dementia has been focused as like memory loss, Alzheimer's disease, but we see a lot more of neurodegenerative diseases. So we want to create that precision neurology platform.
Okay, thank you, Adnan and Marius.
Well, thank you again to everyone for the great presentations. And to move in order, I will ask my question to Immunova and to the Immunova team, right? We had a team presentation there. So the immediate question that came to my mind, or what I would like to learn a little bit more about, is the history of putting this together and how did you come with this project together? I also think I might have understood a direction going towards a non-profit, maybe open science approach for Immunova. And if that's correct, Could you elaborate a bit more on the management of the company or of the society, and what's the model for sustainability?
Thanks for your question. Yeah, we'll be happy to elaborate on that. So Immunova was started last year in July. It was founded by me over here in Singapore. And basically what I did was I found 8 like-minded youths from South Korea, from US, Singapore, India, and Norway, and UK as well. And we came together because we really believed that we wanted this kind of technology to be accessible and not just remain in the lab. And that is really where we decided to come in and decide, hey, let's put together our skills. So we are a very interdisciplinary team. And yeah, we're run by 9 youths who believe that we can put our skills together for the common good. And yeah, we are highly collaborative. We don't really have much of a structure within our team. We do have a few people who specialize on data, programming, UX, UI, and etc. So yeah, that's how Immunova works.
Right. So my question was also asking about sustainability and how do you think you're going to fund this initiative in the future?
I will let Srijan from Norway, can you answer that question, please?
Yeah. So we have a lot of collaborations lined up with a bunch of institutions and universities. And we've used the funding that we have right now to improve our computational power because we're interspersed around the globe and we struggled. Avani has a lot of contacts with pharma and we thought of collaborating there too. Eve is representing us at the Moonshot Young Awards in Prague, which will give us a lot of networking currently. And on top of that, with sustainability, we're in talks with Dr. Ian Chu from GreenieWeb, whose company or institution works on decarbonization of AI models. And nothing is fixed right now, but we've had a few pitches with him and we've had a few discussions about how we can integrate the decarbonization for our model. So that's how we'll make our model more sustainable in the long run.
Thank you.
Okay, Nicolas?
All right, I would follow up with a question to Anueva. So if I understood correctly from your presentation, you work with histopathology images, but also genomic and clinical data, so various data. And for a lot of parts of your presentation, you emphasized ResNet 50, if I understood correctly. Is it capable enough to handle a combination of this data, or how do you tackle this? I was not sure if I understood correctly.
Definitely, it's definitely able to handle this amount of data. Basically, the thing is currently our model is based on a CNN backbone, but we plan to integrate ResNet 50 into it, into the very previously based CNN backbone to ensure that we get a high amount of accuracy, and we do believe that it's gonna offer a better kind of results.
Okay, but you handle the data independently. You don't fuse the data directly, if I understand correctly.
That's right.
Yeah, so I can answer a bit more about that. So we are currently working with 3 types of data. So histopathology data, clinical data, and multi-omics. So we are using early concatenation training version where we are training all of them together by concatenating all types of data together. So our histopathology images are multiplex, so it allows us to have immune subtyping, and our multi-omics data allows us to have more of a genome profiling of each patient and each clinical sample that we run through the training program. And our clinical data allows us to extrapolate this info into our survival and more of our immunotherapy predictions. So these 3 data types are being concatenated into our training model, and we'll run that through our AI. Yeah.
All right. Okay, thank you. And Bella, if I may, I have another very quick question to synthesize, if I may.
Very quick.
Super quick, because I'm also very interested in the topic back in the days. One of the difficulties back in the days was to introduce new instruments, new surgical instruments into the entire setup. Is my understanding correct that with your solution, you closely work with the manufacturers of the surgical instruments, and once you have a model of a new surgical instrument, it's easy to bring it at least into the training setup because it's all virtualized?
Yeah, so it can act, so the simulation setup can act as a prototyping stage if a manufacturer wants to develop a new instrument, that it can be brought in and tested in a virtual environment. And then some of the requirements are already making themselves apparent in virtual simulation. And then they can use this as a feedback, how it would work, how surgeons can interact with it to basically get to a better, improved actual instrument.
Very nice. Thank you.
Okay, thank you very much. I saw previously that some people from the audience raised their hand. We don't have that much time for all the questions, so I highly, highly encourage you to write in the webinar chat or Q&A, and the startups will try their best to answer. Okay, so now we have the final batch, Mira Vision, yeah, ICAX, and Mayo Intel. And the first one, Mira Vision.
Yes.
So yeah, I will give you approval and try if you can see if it works. Great.
Yes. Okay. Hello, we are Mira Vision. We are a deep tech AI startup founded in 2021 in Germany, and we develop AI systems for image analysis in medical diagnostics. What makes us unique is that we have developed a patented technology for the generation of photorealistic synthetic data to robustly train our models. We are a diverse team of our founders and machine learning scientists, and also medical consultants that support us in the medical research questions. We have an advisory board out of industry and also academia. I said that we are working with synthetic data. With synthetic data, we try to solve the annotation problem in medical imaging. So here on the left side, you can see a histopathology slide. And here we could be interested in the average cell size of these muscle fibers. If we want to train a supervised model for this task, we have to annotate a whole bunch of slides to robustly train our model. And this can be very time consuming, and also pathologists are quite expensive, so this can be accompanied by quite some costs. Next slide. At Mira, we use synthetic data to train our models. So here on the right side, you can see a real muscle tissue image. And on the left side, you can see an image that we have synthetically generated. And you can see that visually, there is no difference between these images. What is important to know about these images is that we don't use generative models to create these images, but we use a fully parameterized method. So for each of these images, we can change individual parameters. So for example, the average cell size or the cell density, or also the coloring of our slides. This allows us to train very robust models. And what is also important is that our method directly generates our pixel-perfect ground truth data. So we can train models that allow us to segment the tissue of our images. We have validated this method for training a segmentation model for muscle histopathology, and the results of this study can be read in Communications Medicine. We are currently validating this method for more clinical use cases. One of these use cases is the detection of malaria. Here on the left side, you can see a thin blood smear of a malaria-infected patient. And on the right side, you can see the simulation of this sample. You can see that we simulated red blood cells, white blood cells, and also the infected cells. To validate our data, we train our models solely on the synthetic data, and then we apply it to real-world data and compute the performance of our models. You can see here the results of a system that we have trained for object detection of malaria-infected cells. And you can see the normal blood cells in blue and the infected cells in pink. With our training data, we reach clinical performance. So for our malaria detection, we are currently achieving an F1 score of around 75% for infected cells, which meets clinical standards. We are now moving on to more complex tissue types. So here you can see lung tissue, and on the right side, you can see our reference image of lung tissue. And on the left side, you can see the synthetically generated tissue with our technology. And you can see that there is no real difference between the images. Next slide. Sorry, can you? Yes. Because our simulation is fully parameterized, we can vary individual parameters of the simulation. So here you can see that we have changed the nuclei density in the tissue. And with this, we can simulate typical diseases. So for example, inflammatory diseases.
You have 15 seconds, so you need to wrap it up.
Next slide, please. Yes, the last example that I want to show is also this healthy lung tissue where you can see the reference image on the left and the synthetic image on the right. And with this technology, we try to speed up the development of AI systems for segmentation in histopathology and make this accessible for everyone and used for clinical diagnostics. Thank you very much for your attention.
Thank you. Okay. So next we have ICX. Yes, you have the control.
Let me check. That's great. Hello, everyone. My name is Dennis, and we are building foundational model for brain disease. Imagine it's like a ChatGPT for radiologists. And who are we? We are two smart guys who met 7 years ago at Bioinformatics Summer School, and we have more than 10 years experience in AI and building solutions for healthcare. We have pretty unique experience. We already built 10 different medical AI products across 20 different pathologies with flow 10 million patients annually. And right now, let me introduce you a few terrible things. More than 10 million people die from brain diseases every year, and the trend is getting worse. Just only stroke. It's the second lead cause of death globally after ischemic heart disease. But in the same time, 3 billion health were affected of brain pathologies. And how do doctors try to manage today? They need to use specialized neuroimaging tools and manually review around 500 images to identify any pathologies. And of course, they face burnout due to the growing amount of medical data, doubles every 2 years. The second point, it's not enough radiologists. Just only in Japan, 60% of brain scans are reviewed without radiologist report. And these factors contribute to delay in care and a high retrospective errors in medical imaging analysis as high as 30%. Additionally, costs healthcare $100 billion for retest, second opinion, and complications. But we are offering a solution that would help radiologists in neurologists diagnose brain diseases 10 times easier. And our foundational platform reduces diagnosis time, costs, and risk of misdiagnosis. How our platform works, foundational model automatically analyzes brain scans, patient history, and lab result. It quickly filters out of healthy cases, then generate a detailed report, identify abnormalities, and pinpoint their location in just 5 minutes. Then simultaneously notify all team members of the result. We already have a pretty good result. We tested on 2,000 samples, our CT foundational models to identify different type of strokes or anomaly detection model for identify midline shift or so on. And average sensitivity around 95%, specificity 98%. And the next goal is start to work under CT full body scans to identify metastases, or MRI head foundation model to identify tumors, dementia, or Alzheimer's, or so on. And the main goal is work under prediction model, what can predict early predictions of any kind of neurosurgical disease. And our competitors have a few capabilities in differential diagnosis because they forcing doctors to decide
which patient need medical attention based on the similar symptoms. The most common feedback from clinicians: yes, current solution can identify simple cases or provide yes or no answer just only for one condition, but they miss the bigger pictures. Right now, any physician should use like different types of like AI software, what make their work literally harder than easier. It's the reason why we shifting from late stage diagnosis to early stage screening and precise medicine. We don't just say yes or no about diagnosis. We can explain the reasoning behind our conclusion of the diseases and focusing on patients who need medical attention immediately. And our business model is pretty simple. B2B2G, we will offer a flexible price, just pay-per-use or subscription-based models. Just our target market is US with entry point in Japan, because young, largest and rapidly growth market. And yeah, unicorn like exist, but they cover just like less than 50% of US market and almost zero in Japan. And the most important thing was technology is major. And our go-to-market strategy already have a negotiation with few hospitals in Japan, and we will start our clinical trials in the next 3-4 months. And then we will start like our QMS setup and prepare for PMDA's kind of FDA in Japan. And we will just have our first sales in the beginning of 2027. And our like traction for the last 2 months, we started to work with 2 hospitals. We prepared 2 additional modules, like morphometric modules for MRI, brain MRI, and CT MRI. We developed model for brain atrophy and report generation model, and we just like improve our like model performance up from 90% until to 95. And yeah, that's all. Thank you so much.
Okay, great. Thank you very much. Just on time. Okay. And next we have Mayo Intel.
Bella, can I ask you to move the slide, please? Whenever I said next slide, you go to the next one.
Sure, sure.
Thank you. Stay on this one. Hi, everyone.
Oh,
no.
sorry.
Hi, everyone. I'm Ida, a medical doctor and a PhD researcher working at the intersection of cardiac imaging and AI. Today, I'm going to show you a problem that frustrates clinicians every day. We have the scan, we see the scar, but we rarely quantify it. This directly impacts patient care, but MyoIntel changes that. It's an offline AI tool that segments, tracks, and reports a scar, fast and accurate for the clinicians. Let me show you why and how. Next slide, please. The problem: 1 in 10 people over 60 will have a heart attack, and the scar left behind increases the risk of future heart failure and cardiac arrest. Cardiac MRI can clearly show this damage, but in practice, scar segmentation is rarely done. Why? Because it is slow, manual, inconsistent, and not trackable over time. There is no standard approach, and even experts disagree on the same scan. As a result, this clinically meaningful information is often ignored, not because it lacks value, but because the workflow makes it impractical. This isn't just missed data, it's a missed chance to intervene early when it matters the most. Next slide, please. MyoIntel is designed to work in a way that clinicians think, with 6 principles. First, it is interactive. Clinicians stay in control, guiding the segmentation easily and quickly with just a few clicks. Second, it is non-cloud, keeping sensitive patient information data completely local, secure, and private. Third, it is trackable. The system automatically compares the scan over time, which manual tools simply can't do. Fourth, it is explainable. You see what the AI sees, and you can adjust it if needed. Fifth, it is lightweight. No server or special setup. It runs on a standard hospital computers. And finally, it is intelligent, using AI models that work together to support clinical decision-making. Next slide, please. How it works. Once the clinicians open a scan, MyoIntel automatically detects the suspected scar region and draw a bounding box around it. If they are confident, they can proceed directly to segmentation. If more precision is needed, they can adjust the box or place prompt points to refine the result. 1 click and the system segments a scar, calculates a scar mass, and save everything to the patient report. At follow-up, MyoIntel compares prior results automatically, enabling true longitudinal tracking. And because it all runs locally, the workflow stays focused, right where it belongs with the clinicians. Next slide, please. Thought carefully about where to start and why. We know the UK cardiac MRI ecosystem inside out, with 80 cardiac MRI centers and nearly 50 academic hospitals, all potential early adopters. Our initial focus is on research active site, where clinicians and imaging scientists are already in collaboration. Because MICCAI is local and lightweight, deployment is frictionless. No cloud, no IT holders, and no integration pain. From research partners, we scale through clinical pilots and peer referrals, seamlessly integrated into care by solving real clinical bottlenecks, building trust side by side. Once proven in UK, we will expand to similar markets across Europe and beyond. Next slide, please. Why us and why MICCAI? Because we've already made the jump from concept to product and from research to real clinical use. Our MVP has been accepted at leading conferences, including MICCAI, validating both technical quality and academic rigor. We combine deep learning and cardiac imaging expertise, a rare mix that lets us build tools that clinicians actually want to use. What you see here is the actual interface, clean, fast, and designed hand in hand with cardiologists. It is already in hands of early users, and we've got focused, actionable feedback from the field. As we evolve, our goal is to extend MICCAI into a broader cardiac MRI assistant tool, expanding sequence coverage and structural reporting. While mainstream software exists, none of them offer interactive scar segmentation. Next slide, please. In MICCAI, it is not about replacing expertise. It's about respecting them and scaling it with the right tools. Thank you for listening, and thank you for the opportunity.
Thank you very much, Aida. And now we are moving to the Q&A. So please, judges, ask your questions, and the audience can, of course, ask in the chat. Nicola.
With the unmute button. Thanks, Bella. So I would have a question to Miravision. I think it's also similar to the question one of the audience members asked. Who is actually, like, if I understand correctly, you create a lot of synthetic data that will help overall to build AI models. What I did not understand 100% is, on the one hand, are you building AI models yourself? This is one part, and then one part of the audience or like the users of your product would be AI builder or foundation model builders that will leverage this synthetic data. Or could you elaborate a little bit more on the concept there? What your intention is?
Yes. So we have a lot of machine learning researchers in our team. So at the moment, we are training and developing the models ourselves, and we are hosting an AI platform where users can use our algorithms to analyze their data. And this platform has already being used for the muscle tissue segmentation, and the platform then generates reports of the average density of the muscle tissue, for example. And the idea is that we provide the algorithms or the trained algorithms. And we want to also publish some less privacy data sets, maybe also for research use. And yeah, basically the idea is also that with this technology, we can also adapt to maybe new imaging modalities that where no data sets are available at the moment to train robust model, and then also adapt new to these imaging modalities where we also have collaborations at the moment. And yeah, the users are currently mostly research institutions, but yeah, we are doing the clinical validation, or we want to validate these algorithms also for clinical use in the future.
Okay, so the examples that you showed were not for validation necessarily, but they're actually the products that you want to sell to.
Yes, exactly.
Okay,
so the business
thanks for the
strategy would be like a use of the algorithms. Yes.
All right, thank you.
Bea?
Yes, thanks. I have a question for Dennis. During your product roadmap presentation, a slide, you said that clinical trials are scheduled, and I was curious for you to further develop what is the regulatory pathway for these models. It sounds like the tool is intended to develop models for very diverse and different brain pathologies. So I'm curious about the regulatory pathway for all of these models and how does that fit with your product roadmap and your clinical trials.
Okay, thank you for your question. All right, as I mentioned, we started in Japan. And we talked with PMD. It's kind of like FDA in Japan, and they mentioned, yeah, we can start our process for just like all brain condition in one model, for example. And usually, yeah, it depends on case. After our last meetings, they mentioned it will be okay if we'll show the result of them on like 300 samples in total, but maybe for our case it will be a little bit more. I don't know, maybe like around 1,000. But we, as I mentioned, we tested on 200,000 cases before. I think the main bottleneck is like paperwork in Japan. Usually, in Japan they have two different stages. First of all, calls like certification. We should spend like 1 year, 1.5 years, or 2 years, and then registration. After registration, you can apply on reimbursement system in Japan. In total, maybe 3-4 years. As a first step, I think we will complete it in 2 years. The main bottleneck is in money, right? Because we should spend like around like maybe $1 million for that pathway.
Okay, thank you.
Marius?
Well, thanks again to everyone for a great presentation. So I think my Intel didn't get a question yet, so I'm going to ask my question to Aida, and I'll try also to integrate this with something that I see asked online, because it's on a similar subject. So I was wondering, what is your plan for ensuring clinical adoption of your technology? And this is where I also see the question online about thinking about the no cloud working and the framework used. So what kind of training is required for this? What kind of personnel and skills are required on site? And how do you make sure that clinical environments rather than research environments are going to use your technology?
Thank you for a very great question. So when we are working with clinicians, we have to gain their trust, but when we want to sell AI tools to them. So I'm based in a cardiac leading center that I have already actually 2 clinicians, 2 cardiologists at the professor level. They have already used the product, and we have already tested intra-user and inter-user variability, and we are comparing it with other rule-based tools that are very time consuming. So after we are drafting our paper at the moment, and after we published our paper, we are gonna first work with some other research centers to validate our GUI, and after that we have the trust of the research centers. Then with the cardiologists that we are working, we can move on after doing a short clinical trial to show that actually the mass that is calculated from GUI can be used as a biomarker for clinical decision making. Then we will move to the clinical settings. In terms of what the skill is needed, it's basically so simple. Just the 2 models that are working together, they do everything. They detect a scar, and just we put the clinicians in between. If they are happy with every step, they can click, click, click. And if they are not happy, they can adjust the bounding box or prompt the model to where they want to be like segmented. So they don't need to have any deep learning skill at all. And it is a very lightweight software itself. It's GUI based, and you don't need even a setup or an IT specific setup for this model. I hope I answered your question.
Thank you, Aida, and I'll pass to Alex.
No, thanks. Perhaps like I have 2 questions. The first one is a follow-up question for you, Aida. How do you envision to handle software updates when this is like fully integrated, like with on-prem devices, for instance, also for manufacturers, and you would like to do model updates? So did you think about this?
So yeah, we did. Another perfect question. So in our center, we have enormous data. So we are updating the model every day, that we are like updating the weight of the model that we use every day, because we are having a big amount of data. And in terms of how we are going to update the software that people are using, because when we sell subscription, we have an email address as well. Then we will email them and say, look, there is another update. You should update your software, and it is very completely straightforward. They don't need any engineer or any other person to help the update, because it's just like cloning back or pushing or this sort of stuff. And yeah, what was your second question? Did I answer both?
No, thank you. So the second question would be actually for Dennis from Dennis, how do I pronounce it? ICX? Is this correct?
Yeah, it was like ICX, right?
Yeah, okay. One thing I didn't get, even though Bella asked the question, I think, or Beatrice, I don't remember. On your slides, you talked about a multi-model model, but when I checked your webpage before, it seems that you actually you have developed several neural-based models for each kind of stroke type, for instance, right? And then you chained them together. Is the multi-model model like a vision, or is this already something you developed today?
Yeah, thank you for the question. We did some like a small pivot, right? Right now we call this the foundation model. Literally, kind of like multimodal system, right? We will orchestrate a different model, like visual for visual patterns. When we input that information, input for our foundational model, and you just like, they train based on like some kind of literature, medical imaging. Can you hear me?
Yes.
Oh, great. Then we train just like on medical knowledge, right? As an output, because like our foundation model understand the medical context. And then they have like, some visual patterns. They can explain much more accurate about some diseases, because the main problem when we talk with doctors, why we did that, because we didn't want, just like only one AI software for only one pathology. It's the reason why we realized what we should do, comprehensive solution, but for narrow problem. And it's the reason why we changed that. And right now we use like, a few models for different, a few visual models for different pathology. Then their like output goes to like our foundational model.
Thanks.
All right. So I guess we reached the interesting part, the voting. So now what we will have, I will start the poll for the audience, and in parallel, we have the jury members having their own vote in a different platform. Okay, so I'm starting the poll. Let me know if you see it, just to make sure it's okay. Everybody can see it? Somebody to indicate? Yes? Okay, great. So now you can vote. I just want to remind you the criteria that you need to think in mind when you are doing your voting. So we are looking on innovation of the technology, the impact of the technology, the quality of the presentation, and the relevance to MICCAI. So this is kind of our North Star. But again, you don't need to, you don't have here a specific criteria or something like that. All you need to do is just to vote for your favorite 5 startups that you think are the best in these terms. And what we will have, like I said, we have a separate jury voting in a different platform. And the final vote will be 50% composed of the audience vote and 50% from the judges. And of course, we are not done here. So we will announce soon the top 5 startups. So we'll announce it here. And after that, our jury will think through go over all the material, also the material you sent to us in the application, and also on the videos and the questions that you answered, and think about it very deeply. And then they will rank the startups, and we will get all the top startups, and we'll know exactly who is the winner, the second place, the third place, and so on. Okay, so this is how it will go. I will give you some time to vote and think about it. But meanwhile, I'm just reminding you, how this goes. So again, all the startups here in the pitch competition will get a direct connection to NVIDIA Inception program and also a AWS startup program. So also, even if you will not be among the top 3 winners, you still will get nice perks here. And the top startups, they will have a free registration to the MICCAI 2025. And maybe even more important than that, you will get a dedicated space to MICCAI exhibition area. And also the top startups will be networking partners at the MSB networking event. This is an event that is organized by the student board, but at the end of the day, it's a networking event. A lot of startups will be there, researchers, of course, also companies. So it's a very nice event. And the winning startups will be the networking partners there. So we'll sit on the tables of the networking partners. Another thing to mention here so we said that the top 3 startups will get the free registration and also a MICCAI Society membership. And the first winner, the first place winner, will also have a $1,000 travel award. So it will also help you to travel to MICCAI, and it can also be, of course, very helpful. So thank you very much for the judges here. So we have Marius, and who is, of course, the president of the MICCAI Society. We have Nicolas from NVIDIA. We have Alex from AWS. We have Bia from Kitware. So we really have a great set of judges here, both from the academia and of course from the industry, from different industry companies. First and foremost, thank you very much for all the participants in the pitch competition, all the startups here. We have here 9 startups who reached the pitch competition, and it's also a nice thing to have. So we had more applications, and of course only the selected ones are here. So thank you very much to all the startups. We will soon check. We will soon close the audience vote. I see here that there is a very high number of participation. So I think what we will do now, yes, I see we have 100, I mean, all the participants already voted. So what I will do, I will end the poll, and I will share the results with you, so you can already see the results of the audience. Okay, so you can see here that from the audience, we have Immunova AI getting 66%, and we have, what is the second place? 43% for Synthesize. And we also have Silytics 24%, Mirrorvision 24%, Hist AI 23%, HiRod we have 11%, we have Gray Metal Solution 12%, ICX 14%, and Mayo Inter 12%, but this is only the audience voting. So out of those, we are selecting the top 5. Okay, and we will soon collect also the jury votes. and see who are the winners here. Okay, so so please, I will just need to know when we have all the results, having also from the jury members. I think we still need to finalize the exact voting there. So maybe meanwhile, I will give the jury members, if you want to say something.
Well, I will say something. So again, congratulations to everyone who participated here for the great presentations. And this is very exciting. And I really look forward to seeing as many of you as possible in Daejeon at MICCAI in September. For the first time, we'll have at MICCAI displays and showcases for the startup companies that are going to be there in person. So this is very exciting at NU, and it will be an acknowledgement of your great work and allow you to do networking, as Bella has explained, and also to get some level of potential mentorship that the MICCAI Society is offering at many levels, including to some of our startup companies. So I know not everybody is going to get some financial support, right, through this competition, but I'm hoping that will not stop you from coming to MICCAI. But also many thanks and congratulations to Bella and Nicola for organizing this great event, and something that I'm hoping we're going to see now every year, at least every year, right, at MICCAI in the future, and something that our society is also very much invested into supporting in the future.
Okay, thank you very much, Marius. So we will soon, we are just finalizing our results. We have some close results here, so we are just looking on the total numbers. Again, thank you very much for all the startups here, and we are doing our final calculations.
Yeah, and I'll take over from Bella here, that she can use her eyes and brain to double check the results that I posted her in a private message. So also from my side, thanks a lot for all the presentation. I think it's the 5th edition that we do this MICCAI Startup Village now. I really like this version now. We have seen so many different companies from all of the globe. We have seen Singapore, from Europe, from US based, many different topics. And what I really liked, actual MICCAI research papers that make it as a combination into a product, and makes me very, very happy, because I think it's important to realize that it's not just a MICCAI paper that is published and afterwards is forgotten. It is actually, it can have an impact on patients, and thank you for the startups for presenting that. I think it's really reassuring and happy to see that. So independent of who will be the top 5 startups, I would like to thank all the startups to present here. They had different maturity in terms of startup roadmap. All in common was you're really great. So thank you for taking the time to prepare the presentation to present for this 2 hours. I know that they also submitted the pitch in a digital version, so we'll try to upload it on the website. So also for the ones that did not make it to this pitch competition, they will have to see a chance to see your pitch. Bella, did you double check the results? I don't. That just to make sure that we don't have a, because the results were very close. I just wanted to make sure that we have a double check.
Yeah, Nicola, just one more minute. I will do
right.
also the calculation myself, just to make sure. Sorry.
You know, that's attention span at the end, right? It would be easy to just announce it. And just as a reminder how it works, so we're going to identify the top 5 startups, like based on the audience result that you already have seen, 50% for this count, number of counts, so this is 50% and 50% from the jury members. We only have 4 jury members, but we had 74 active counts, so we have to normalize it. So we identified the overall 5 top winners, and then in the second voting process, the jury members will spend way more time than just a few seconds now that we had to identify the top 5 and going really deep in the evaluation according to impact of the technology, innovation, relevance to MICCAI, and do the top 3. So the top winner will get, all top 3 will be invited to MICCAI, have free registration, as we had said. We'll have a dedicated space in the exhibition hall, and I hope you really got a chance to connect to the other MICCAI researchers and also connect with each other. The networking event with the MICCAI student board, where you're going to have the chance to recruit also new talent. And the first place will also get some support for the travel, because it's going to be in South Korea this year. So a little bit of travel support, probably it's valuable. Bella, are you ready? No. All right.
Not yet, not yet. I'm just need to do the final calculation.
And one of the follow-ups that we were going to do with the startups, so some of the startups were already some in the programs of AWS and NVIDIA, but this is definitely one of the benefits that we will follow up with you. So giving you a direct connection to NVIDIA Inception and also to the AWS program. This will be a follow-up outside of this top 5 and whatever. So it will be a benefit to all the startups if you want to, not mandatory.
Mm-hmm.
Bella, this tension. Not to put you under pressure, but
I know. My brain doesn't work that quickly under the tension, but I will try. I will try.
all right. And for all the other members that are listening right now and will attend MICCAI, please definitely reach out to the startups, not only in the exhibition hall at MICCAI, but also outside. So most of them have a website. Please contact them there if you see a room for collaboration in terms of research, or if industry is joining as a participant, please free to reach out to them. They all have amazing solutions.
Mm-hmm.
Bella, do you agree
Nicola, I
with my
think,
evaluation?
yeah.
So we triple checked. The result is there. All right. Then you have the honor to pull up the other slide deck where I already put the top 5 startups in there.
Yeah. So I will do that. Okay. So I'm stop sharing the poll of the. And also, we need to move to the second. The second slide deck. So are you ready? Because now when I'm sharing, you are seeing the results. Okay, so congratulations to the top 5 startups of the Startup Village: HiRad, Hist AI, MiraVision, Silytics, and Synthetize. Congratulations to you all. And also, again, thank you very much for all the participating startups in the Startup Village. This was very close. It's not like we really needed to calculate it very deeply to see the final results. Thank you very much, everybody. And now, like we said before, the judges will do the ranking and decide between these top 5 startups who will be the winner. Okay, so thank you very much, everybody, for your participation. Well, the top 3, we will see you in MICCAI, and also the other startups are welcome to come and join us in MICCAI 2025. Thank you very much, everybody. Thank you very much, the audience and the jury. With that, we'll wrap up.
And the effort, it takes a lot of work. So thank you for all the hard work. Thank you.
Yeah, thank you, Bella, for spearheading that. So you were the lead for the Startup Village this year. Amazing work. So thank you.
Yeah, and Nicola also did quite some work here. So thank you as well. Okay, thank you, everybody. And we will announce the results on July 28th. Okay, thank you. Bye-bye.